Welcome to another episode with Medical Justice. My name is Jeff Segal. I'm both a neurosurgeon and a lawyer. Medical Justice is an entity focused on keeping doctors from being sued for frivolous reasons. We also manage a collection of other thorny medical legal conflicts, including hospital privileging matters, Board of Medicine complaints, national practitioner data bank reports, and assaults on reputation. So today we're going to talk about, can patients sue over referrals, meaning you refer the patient out to another provider. Can they sue you for your decision? Anyway, referrals are what we do. I mean, nobody really does it all to the extent something is outside of your comfort zone or your background training and experience. You refer it to someone either that you know, or at least you give a general idea as to the type of physician the patient needs to see. So these patients may be unhappy with the person you refer them to, or even to the facility. The question is, can this unhappiness escalate into a lawsuit against you, the doctor who was just trying to do a good deed? So the short answer is yes. Can a patient sue you? Yes. We live in America. Lawsuits are like mom and apple pie. You can sue in America for almost anything. But the real question is, would they prevail? Meaning, is there a legal merit to suing for a referral? So how might a patient try to sue you? What are the legal theories for this? And these are commonly negligent referral, meaning that you either knew or should have known that the provider you referred the patient to was unfit, was unable to be competent. Number two would be failure to warn, meaning not disclosing to the patient that the referring doctor has a collection of challenges, such as, 8 malpractice claims or a history of being disciplined by the Board of Medicine. And then finally, agency theory. So if the referral is in-house or that individual is part of your practice, everybody gets lumped together, meaning that, you're all under the same roof. And if they're unhappy with the other person under your roof, you'll be along for the ride. All right, so these are the things that a court will consider in terms of trying to answer the question, should you be sued, and meaning that should the court rule against you, should the jury rule against you? So was a referral within the standard of care? I mean, so many things point to the standard of care in the medical world. And did you, the referring doctor, have any reason to doubt the provider's competence? Sometimes this is where knowledge plays a role. Did you have pre-existing information in your brain that the doctor you referred the patient to had all of these challenges or problems? Next, did you disclose any conflict of interest? Meaning, are you in business with that other doctor outside of the medical world? And did the patient have the ability to exercise their freedom of choice? Were they able to make an informed decision, either see the doctor you told them to see or go elsewhere? Or was their arm twisted so that they really had no functional choice? All right, so how can you protect yourself in this domain? Well, explain why you're sending this patient to the other doctor. Explain the reason for the referral. The more information you put into it as to why this is the right individual, the person with the correct background training and experience, the more you'll be protected. Next, if you know somebody's got a problem in the past, just avoid them. If they have a bad track record, if their clinical outcomes are poor, you probably don't want to send your patient to them anyway. I mean, the patient's not going to be happy by having them accept additional risk. So if you know that they are not that good, why in the world would you ever send the patient to that doctor? Next, if you've got a ownership interest with another doctor, you probably need to disclose that. In some states like California, for example, if you share ownership in a surgery center, you need to disclose that. Whether or not you're legally mandated to disclose that, it's probably still a good idea, because then the patient has informed choice. They can make a decision as to whether this actually matters to them or not. I think if you give the patients more than one option, that also inures to your favor, meaning that there's less liability to you if you give the patient a couple options. And sometimes giving them a couple options is useful because it may be challenging or difficult to get a scheduled appointment with just one doctor. But if you give them a couple of options, it'll decrease their frustration factor as they try to make an appointment. And then if you're referring in-house, try to figure out whether whether there are appropriate boundaries or not. Sometimes it does make more sense to ship it out of house. But if you're in a large multi-specialty practice, it makes a lot of sense to ship in-house, but just trying to figure out what is considered an appropriate referral. So dissatisfaction doesn't necessarily equate to liability. For a patient to prevail in a lawsuit against you, they'd have to demonstrate damages, that they've been harmed, that you had a duty and you breached that duty, and that breach caused damages. So they have to run the board on this to sue you for negligence. I think if you give them more information, if you're transparent and document the rationale for the referral, and you give them substantive choice, and you don't steer them to bad doctors, you're likely to steer clear of getting sued for a referral. All right, so sometimes there are combinations of these different challenges. So here we've got referred to a less than qualified individual. More importantly, you knew he was less than qualified, and you had a business relationship with this red flag individual, and you told the patient this was the only person you should go see. You could see that the combination of this fact pattern would not be helpful in defending against a negligent referral lawsuit. Anyway, this is a whirlwind tour. We complete our discussion related to getting sued for referrals. If you have any questions, please feel free to contact us at info@medicaljustice.com. Again, info@medicaljustice.com. And by the way, you can sign up for a free 15 to 20-minute consultation for any medical legal challenge or conflict that you have. Just go to medicaljustice.com or click on the QR code in the bottom right-hand corner of your screen. It will take you straight to our scheduling module. You can sign up for, again, a free 15 to 20-minute consultation about your thorny medical legal conflict. So in any event, what do? We help manage conflicts. That includes frivolous lawsuits, hospital credentialing problems, Board of Medicine complaints, National Practitioner Data Bank reports, assaults on reputation, and on and on and on. Anyway, until we meet again on ViewMedi, we thank you for your attention. Again, the QR code on the right-hand portion of your screen will take you straight to our scheduling module for a free 15 to 20-minute consultation about any medical legal conflict you may be experiencing.